right, here's a spine and hip routine that's very basic to help with movement, strength, and flexibility. So you're going to start sitting on the edge of a chair with your feet hip distance apart. And you're going to start with your arms resting at the side of your body and just close your eyes for a moment, take a breath. And then let your body sink into your chair. So under your bum, you have two sits bones that you're going to allow to just sink into the chair and relax around those bones. So relax all the muscles in the lower part of your back, in your hips, in your groin, in your thighs. And just breathe and let go for a moment. Good. Open your eyes. We're going to start with your hands on your thighs, and you're going to round your back and then come forward and arch a little bit. Round back, arch forward. Round back, arch forward. Loosening that low back. Not looking for a major stretch. You're just really looking at moving with ease. Keeping it comfortable, no pain. So if you're feeling pain, make the movement smaller. Let the head sort of relax and go along for the ride. So your chin will tuck as you round back and then back to straight as you extend the spine. Good. Come back to sitting tall. Relax your arms at your side. Take a nice deep breath. Let your sits bones sink into the chair. Think of your whole spine sitting one vertebrae over top of the other. So you're sitting tall, but the bones are supporting you, and so you can relax all the soft tissue around. Relax your low back, your belly, your hips, your thighs, your bum. Open your eyes. We're now going to do an exercise where you're going to place your finger, any finger, in the center of your belly button, and you're going to shift your belly button side to side. So you're not shifting off the chair, so you're not lifting your weight to one side or the other. You're keeping even weight on both sits bones, and you're shifting your body side to side, leading from your belly button. So we're trying to ease up that low back, free up some of the tension. So you're shifting side to side without causing any pain. The movement doesn't have to be very big. It's like when you hit the wall of resistance, you change direction and you keep going back and forth. It's like you're coaxing that part of your spine to release. Good. Back to center, arms to your side, close your eyes, deep breath. Let your sit bones support your spine. Let your spine stack one vertebrae over the other and relax everything around it. Relax down your back, relax down your front, down your sides, your hips, your thighs, and your legs completely. Good. Hands back on your thighs. You're going to extend your legs out a little wider just for balance. You're going to bring your arms out in what I call cactus position and make sure your hands are back with you. We're going to rotate. So you're going to turn your body side to side. Your head will turn with you. Again, the movement's happening in your low back mainly. There's some upper back rotation for sure, but think of allowing that movement to happen along your belly button area also. So relax through the low back so that movement can happen there. Trying to free up the lower part of your spine. Good. Slow the movement down. Come to a rest. Lower your arms. Bring your feet back in. Close your eyes. Deep breath. Release all the soft tissue down your back, down your front, down your sides, into the legs. Least amount of effort sitting up. Good. Keeping your arms to your side, side bend. So reach one hand down towards the floor and then back to center. Reach the other one, back to center. So you're side bending. If this is a little bit hard keeping your balance, bring your legs wide. You may have to sit back on your chair a little further, that's fine. So think of the movement going at least all the way down to your belly button again. So trying to get the low back involved a little bit. If there's pain and you can't go that far, that's fine for today. And you see if over time, if that improves, if you get your fingertips a little bit lower after you've done this program or this video a number of times, it should get better and better. So you're not forcing your way down, you're kind of surrendering and letting your body relax all the way down. A few more. Last one. Back to center. Draw your feet back in if they were wide, arms to your side, close your eyes, deep breath. Nice work. Good. You're going to come into standing. You can move the chair if it's in the way. You're going to come down to a mat or a carpet surface that has maybe a little bit of cushioning. Maybe you throw a blanket on the ground if you need the extra padding. You want to be comfortable. You're on your hands and your knees, so wrists under shoulders, knees under hips. And we're going to carry on with a little bit more of spine movements. You're going to tuck your tailbone under and you're going to round your back, tuck your chin. And then come back to a straight spine and then relax your belly, relax your chest, let it sink down towards the floor. Maybe look up a little bit. Make sure you don't compress your neck, so keep the back of the neck long. And come back to neutral. Tuck the tail around your spine. And then exhale as you let the belly sag, the chest drop, slightly lift the head. And reverse. Inhale. Exhale. Inhale, tuck and round. Exhale. Drop the belly, drop the chest, lift the head. And a couple more. Don't go into pain. Stop when you feel a wall of resistance. Last one. Letting the belly hang, the chest. And come back to neutral. Good. Shift your hips over to the right side and look over your right shoulder with your head, creating a side bending of the spine. Back to center. Hips to the left, head goes over left shoulder. Back to center. Inhale over, exhale center. Inhale over and center. Keep going. We're building strength and we're building flexibility through that spine. Anytime you suffer hip pain or leg pain, the source of it is often coming more from the back or the pelvis area, so we want to make sure we include that in the exercises. Last one going over, back to center, nice work. You're going to make your way down to your mat, flat on your belly. And you can stack your hands under your forehead. Take a breath here. Let your body sink into the floor. You're going to gently press your pubic bone down into the floor. You're going to think of pulling your belly button away from the floor. So it's like you're gently pulling the belly button off the floor towards your spine. So your abdominal muscles are kicking in a little bit. Then you're going to squeeze your right bum muscle and you're going to float the right leg off the floor. Don't have to go high, just trying to activate a little bit of bum muscles and drop down. Keep the pubic bone down, belly button off away from the floor. Squeeze the left bum, float the leg up and drop down. Inhale, squeeze the right bum. Exhale, float the leg up. Inhale, drop the right leg, contract the left bum. Exhale, lift the left leg. Inhale, drop, squeeze the right bum. Exhale, lift. Keep going, dropping, squeezing the bum, lifting the leg. And switch. Keep alternating. Pubic bone is gently pressed down, belly button is engaged. Away from the floor. Squeeze the bum, then lift the leg. This is good to strengthen your glutes, your bum muscles. Also working the movement at the hip joint, so we're helping stabilize the hip. And the more you lift when you're laying on your belly, you're essentially creating space at the front of your hip. So you're stretching the front of the thigh. Drop down, last one. And take a pause, deep breath. Release the tension in your hips, relax your belly, relax the pubic bone. Good. You're going to roll over to one side. You're going to bend your knees. Heels will be in line with your tailbone. Rest your hand on your arm. You can have your elbow bent, or you can have a cushion if you're more comfortable with that. You're going to start with your feet glued together. Your hand's going to be over top of your iliac bone, so some people refer that as the hip, but this is your iliac. And this should not move. You're going to lift the top knee off the bottom knee, and then roll back down. So you're lifting your knee, but you're not allowing this to roll back with you. This stays forward. So again, you might have to engage belly button in towards your spine. That'll help to stabilize this forward. And you can lift your leg free so that the movement's happening right down lower here where the ball of the hip is rolling inside the socket. Call these clams. So you're lifting and you're lowering, keeping the belly area engaged, pulling back. Your lower ribs here, maybe pull these back. That'll help stabilize you. And your focus is moving freely through this hip joint. So you're trying not to tighten too much through the hip. You're trying to stabilize the upper portion of your body so that the lower part can move freely. One more. And drop down. Good work. You're going to straighten that leg on your mat. You're going to flatten your foot, so flex your foot. And you're going to drop the leg and you're going to lift. You don't have to lift very high. If you go to the height of the body or a little higher, that's sufficient. And you can keep your hand here, or you can have your hand in front of you. You don't want your hip to be coming up towards your head. Like by hip, I mean like the iliac, the pelvis. That doesn't move. So the movement is actually happening a little bit lower, right in the hip. So there's a ball rolling in a socket. And so your waistline doesn't shrink. So one mental note you can make here is thinking of lengthening the leg. So if you push through your heel and keep the leg long as you lift, it'll keep the focus, the movement from happening in your waist or in your pelvis area. It'll allow you to stay focused on having the movement happen where it's supposed to in the hip joint. So reaching that heel away from your head, not reaching like crazy, just think of lengthening as you lift. So you push through your heel and you float the leg up. Your kneecap should be facing forward. So your toes are pointing straight in front of you. And you should be feeling that just behind in the bum. If you're feeling it in the front, your leg is too far forward, take a peek. Make sure that leg is straight with the rest of your body, or even a little bit further back, just to make sure you're doing it right. Last one, you should be feeling that. Bend your knee and release completely. Nice work. You're going to push yourself up. You're going to swing your legs over. And you're going to slide your way down to your other side. Again, you can use a cushion under your head. Heels are in line with your tailbone. Knees bent. Place your hand on your iliac, on your pelvis, and lift the top knee and lower it down. Lift and lower. And lift and lower. Just like that, keep going. If you're having a hard time keeping this stable, your focus has to be more on your abdominals. So it's thinking of pulling all of this, the whole surface, pulling it in towards your spine, working your core muscles. And the legs should be moving freely. So without too much, it might be hard because there's weakness there, but I mean, you shouldn't be like tensing through that leg. The legs should be as relaxed as you can make it. Last one, and lower down. Good, straighten that top leg. Take a peek if you need to. Flex the foot, lengthen through the heel. Hand could be on your iliac or could be down on the ground. You're gonna lift and lower. So lift and lower. Belly button in. Your ribs want to pop forward usually, so you got to consciously think of keeping this going back. Lengthen through the heel as you lift, trying to keep the minimal amount of tension in your leg as possible. Last two. Bend your knee. Nice work. Roll over onto your back. You're going to start with your knees bent. We're going to pelvic tilt back and forth just a few times just to loosen our back after having worked the hip a little bit. Good, and you're going to stop halfway in between. So you're not flat into the floor and you're not super arched, you're in between. You're going to pull your belly button in. You're going to straighten your right leg. Toes are pointing towards the ceiling. You're going to lift it off the floor and lower back down. Lift it and lower it. Lift and lower. See how high you're comfortable going. You could be going off the floor just an inch. You could be going off the floor a few inches. Or you could be coming off the floor until your leg is level with the other one. Your thighs are parallel. And lower. So see what feels right for you. Building strength in the front of the thigh. You may not be able to lift very high. You may feel like you're tensing everything. So the idea is like using the least amount of tension. So I don't want you clenching your teeth or tightening through the throat. So see what works for you. You might just be slightly lifting and lowering. Slightly lifting and lowering. And that's fine. That's where you start. Last one. Drop the foot, bend the knee. Nice work. Other side. Toes pointing towards the ceiling. When you're ready, lift and lower. Lift and lower. So belly button area, the whole abdominals pulling in, stabilizing. Even your lower ribs, think of pulling those down towards the floor. Strengthening a lot of things. When you do this, you're working on your core, working on the front of the thigh, even your quads working, keeping your legs straight. Flexing your foot, so you're working the shin area, the lower part of the leg. Last one. Drop the foot, bend your knee. Nice work. If it's there for you, you're going to cross your right leg over left. If it's hard, you may have to help it, or you may have to wrap a strap around the ankle and say, oh, I can't quite get there, but this is as far as I can go. And you can hold the strap in your hands, that's fine. We're going to try and stretch our hip area a little bit. If you can cross over, your foot's just resting. And then you can just stay there and breathe. If you're already feeling that pull, then that's as far as you should go. If you want a little bit more, you can push on that knee. You might be feeling a little bit more in your bum as you push through that leg. Or if you want a little bit more of a stretch, you then lift your other knee in towards your chest. So you can place a strap under this leg if it's too hard to go up and reach for the leg. You can throw a pillowcase or a belt or anything like that, and then you can pull that knee in towards your chest. And now you should feel a pretty significant stretch going in through your bum and hip area. And you just hold and breathe. You can actually stay here as long. If it feels really good and you get a lot of relief from this, you can hold this anywhere between 1 to 5 minutes. If you're going to hold it for much longer, you might want to get comfortable and have something under your foot to prop your foot and get really cozy, and then try and relax in the pose as much as possible. So uncross the leg for now, drop both feet down, take a breath. Nice work. Cross your other leg. So like I said, you may need a belt or a strap or a pillowcase to bring it in if that's hard, and that might be as much as you're going to do. That's fine. If it's fairly easy to cross, then you may want to push down on your knee or on your thigh. Give it a little stretch that way. And if that feels pretty good and not too significant, you may want to pull this knee in towards your chest. You may use a strap or a pillowcase or a belt again, and you're pulling in and feeling that in your left hip area, in your bum. And then you enjoy the stretch and you just hold and you try and relax your body as much as you can, especially in that left side. Where you feel the stretch, you want that area to be as relaxed as possible so that the flexibility lasts longer. So if you're fighting against it and you can't do the exercise without tightening up, it's too advanced. So you go to the easier one for now until you get better at it. The more relaxed you can keep yourself during a stretch, the longer lasting effects you will get. So always remember, it's more about how relaxed you can stay in the pose. You can hold this between 1 to 5 minutes, whatever feels right. Listen to your body. For today, we're going to uncross the leg, place the foot down, straighten one leg, then straighten the other. Let your legs flop towards the outer edges of your mat. You're going to flip-flop your legs in and out, rotating in at the hips so your whole leg bones are going in and out, in and out, in and out, in and out. And relax completely. Relax your arms, turn your palms to face the ceiling, and close your eyes. Take a few breaths here and just let your body sink into the floor. Try and feel the effects of all the exercise you've done today. Relaxing specifically in the low back, in the hips, and in the legs. So try and relax those areas as much as you can. Relaxing after a series of exercise is the most important part of your program. If you relax what you've just exercises, you'll get longer lasting changes, lasting effects. So don't skip out on this part. Last breath. If this is a comfortable position for you and you want to stay a little bit longer because your body's slowly relaxing, by all means, just stay in the position as long as you want. Thank you for joining me.